Hi, my name is Brianna Andrews. I teach American Sign Language at Crafton Hills College in Yucaipa, California. Today I'm going to show you some communication suggestions to use while responding to calls for deaf patients. While I teach American Sign Language, today's video is going to focus on gestural communication that will aid you in your communication with your deaf patients.
Welcome to EMTprep.com. This is the Patient Assessment Management Medical Skill.
Welcome to the Medical Patient Assessment and Management Practical Assessment. Here we will evaluate your ability to assess a patient, interview them, and verbalize the treatment of all conditions you find. As you move through the skill evaluation, I want you to voice everything you are assessing. During the assessment, you will have 2 EMT partners to assist you. I may have to clarify treatments with you during the assessment as they arise. You have 15 minutes to complete this skill. You may take this time to review the equipment before you. You arrive on scene to a 24-year-old female who's complaining of difficulty breathing. Your scene is safe, and you may begin the assessment at the patient's side.
Okay. BSI, is my scene safe?
Your scene is safe.
All right, so based on my dispatch information, my patient's nature of illness is respiratory distress or difficulty breathing. Is this my only patient?
This is your only patient.
Okay. Right off the bat, I'm going to request an ALS ambulance.
ALS ambulance is en route.
All right. Based on the nature of illness and my patient's presentation, I don't think C-spine is something that I need to consider. So general impression is I have a 24-year-old female seated in the tripod position, having difficulty breathing. As I walked in the door, she's alert and conscious, so I'm going to give her an A for level of consciousness. So, ma'am, my name's Dan. I'm with the ambulance. What seems to be the problem today?
To introduce yourself, say hello, my name, and spell your name. If you're not familiar with the manual alphabet of American Sign Language, there is a link posted below where you can watch and learn your ABCs. After you introduce yourself, you can tell the patient that you're here to help. I'm right-handed, so my right hand is in the shape of what we consider an A, and my left hand is palm up, and the sign goes in the direction of the patient. I'm here to help. And then you can ask them what's wrong. Assuming that they are going to try to communicate back with you, you can tell them you don't understand, to communicate slower, or you can write or use your phone to aid in communication.
My chest just feels really tight.
Okay, and it seems like you're having some difficulty breathing, is that right?
Yeah.
Okay, so her chief complaint is, again, difficulty breathing. So the first thing I'm going to do is move through my ABCs. A, airway. As I listen to her, can I hear air moving through just fine? Do I hear stridor or anything like that?
She is having difficulty breathing,
Okay.
but she is moving good air.
Okay, so she's moving air well enough. So breathing, I would assess a respiratory rate either with a stethoscope or by standing or watching and counting. What is her respiratory rate?
She's breathing at 24 times per minute.
Okay, so along with the breathing, I also want to listen to lung sounds.
At any time during your assessment that you're going to be making contact with your patient, you want to let them know how and where that contact is going to be taking place. For example, during your ABCs, you're going to use your stethoscope to assess breathing and first place it on yourself, showing them the locations where you'll be checking. Then point to your patient and they'll understand that that's what you're going to be doing to them next. If you need to instruct them to take a deep breath, use the sign breathe with the same movement, frequency, and speed that you would like them to replicate their breath. So breathe in and breathe out. If they're trying to communicate to you that they have quick, shallow breathing, it may look something like this. Whereas if they're taking deep breaths and yet still can't pull in enough air, it might mimic something more like that.
Can you take a couple of deep breaths for me? All right. Last deep breath. Okay, what are my lung sounds?
You have wheezes in all fields.
All right, based on that, I'm going to go ahead and put my patient on high flow oxygen right now. I'm going to use a non-rebreather and go at 15 liters per minute.
You can verbalize putting the oxygen on the patient.
Okay.
Again, before you supply oxygen to your patient, show them how and where this oxygen is going to be provided for them. If you're using a nasal cannula, show them O2, which would be your oxygen, and show them that it will go up their nose and around their ears. If you are using a non-rebreather, show them it will be masked over their nose and mouth and around their head.
So after breathing, we're going to move on to circulation. First, we'll check a pulse.
When taking your patient's pulse, first use your 2 fingers and your own wrist to demonstrate the actions. Again, point to them, and likelihood is they will then extend their own wrist for you to proceed with taking their pulse.
What is my pulse rate?
Pulse is present and it's at 96 beats per minute.
Okay. Do I note any major bleeding?
No major bleeding.
Okay. And then moving on to skin. Skin color looks pale. Do I note any cyanosis anywhere?
No cyanosis.
Okay. And as I feel it, does she feel warm? Does she feel cold?
Normal temperature.
Okay. And do I notice, is her skin wet? Is she sweating? Anything like that?
No. Normal.
Okay.
Before assessing your patient's skin, touch your own forehead before you touch theirs, and demonstrate the pinching of the finger to identify capillary refill before you proceed to pinch theirs.
So I'm going to go ahead and make this a priority patient. We'll try and transport her as quickly as possible.
At this point in your assessment, you've probably determined whether the patient is a load and go or stay and play. If the patient will be transported to the hospital, you can inform them that the hospital will be where they are going to go.
So next I'll move on to my, my OPQRST. So ma'am, how long ago did this start?
Next, we move on to our OPQRST. O for onset. If it is a illness or a condition, use your middle fingers on your stomach and your forehead. Or if it is an injury, use your 2 index fingers moving towards each other. Once you've identified the illness or condition or the injury, you can ask when, or you can sign start with your eyebrows lowered. Your eyebrows in turn are going to be like your question marks. Your patient will understand that you are asking them a question. So, start.
About an hour ago.
Okay. And what were you doing when this started? What provoked this?
P, provocation. Illness or injury, okay? It starts, what were you doing? This is a sign for do. And again, your eyebrows furrowed indicates that you're asking them a question. So what were you doing?
Just watching TV.
Okay, just watching TV. And can you describe the feeling for me?
Q, quality. You can ask your patient to describe. We use 2, these are called F hand shapes, the letters F, and you move them back and forth, alternating their movements. Describe the feeling.
Yeah, it just feels really tight in my chest.
Okay. And on a scale of 1 to 10, 0 being not difficult to breathe, 10 being I can't breathe at all, where would you rate this?
S, severity. You're going to be able to identify a lot based on your patient's facial expressions. Not only do we show emotion through our face, but in American Sign Language, there's also grammatical inflections that are displayed on a person's face. So you can ask them, injury from 1 to 10, you, where? And if you need to identify, 1 is kind of hurts, versus 10, make sure your face looks like it is the most painful thing you've ever experienced.
About an 8.
About an 8. Okay. And again, how long has this been going on for?
T, time. The injury or the illness started when? How long? If you would like to ask the question using those terms. For the sign long, you use your index finger on your dominant hand and trace it up the arm of your non-dominant arm.
Okay. So, and then after I've got my OPQRST done, I'll move on to my sample and try and get a little bit more information. So, do you have any allergies?
Next, we move on to sample. We've already discussed the patient's symptoms, and now we move on to allergies. To sign allergies, you touch your nose and sign oppose. Nose, oppose gives us allergies. Raise your eyebrows and point to your patient, and they'll know that you're asking them a question.
Yeah, I'm allergic to penicillin.
So you're allergic to penicillin. Are you on any medications currently?
Medications. Take your middle finger of your dominant hand and have it point downward. The middle finger touches the palm of your non-dominant hand and moves back and forth like this. Medications, you? Again, raise your eyebrows.
Albuterol?
You take the albuterol, okay. And past medical history.
To inquire about a patient's past medical history, you'll sign past. Medical, same sign as medication. And you can sign problems. This will include both illnesses and injury. Past, medical, problems. Take your index finger and your middle finger on each hand and bend them down and move them alternating in up and down motions.
I have asthma.
Okay, you have, so that's probably what the albuterol is for. What was the last thing that you took as far as food, last oral intake?
To ask a patient about their last oral intake, sign eat. Your hand shape is like this. Eat. Drink. Recent. Your index finger turns backwards and moves up and down on your cheek. Recent. You. What? You can also proceed to ask them when. Your index finger on your dominant hand moves out away from your body and circles back in and up. When?
Breakfast this morning.
Okay. All right, and events leading up to this, what were you doing again that caused this?
I was just watching TV.
Just sitting there watching TV. All right. So next I would move on to my secondary assessment. For this patient, I really want to listen to one sounds again and reassess that. So I'll listen again. Have my lung sounds changed at all with the oxygen?
No, they're still wheezy.
Okay. Has my patient's ability to breathe, does she feel a little bit better with the oxygen?
She is breathing easier with the oxygen.
So after my secondary assessment, I would obtain a baseline set of vitals. So first I would acquire a pulse rate.
Her pulse is 90 beats per minute.
90 beats per minute. Okay, and what's her respiratory rate now?
The respiratory rate is 20 breaths per minute.
20 breaths per minute. Okay. And lastly, I would get a blood pressure. All right, and what is her blood pressure?
Her blood pressure was 112 over 70.
Okay. All right, so now that I've got my baseline vitals, my field impression of the patient is that she's having an asthma attack. At this point, I would do interventions. If she had her albuterol inhaler with her, I could assist her with that. And then after that, I would continue to reassess her respiratory rate, her blood pressure, and her pulse as I waited for the ALS ambulance to arrive.
A few things to remember. Every deaf person is an individual human. We don't all speak alike. We don't all use the same language. Some deaf people will sign American Sign Language while others may lip read. Some may have American Sign Language as their first language, while for others, they may have grown up learning English, Spanish, or another spoken language. One approach may not work with everyone. Try the best to fit the needs of your patient. Use the resources you have. You can ask a patient for their ID to help you get their name, address, date of birth, and other pertinent information. You can use your cell phone to write notes back and forth, or you can potentially look at their cell phone and check their medical emergency ID. See if there's any other information that can easily be pulled from that device rather than engaging in the back and forth conversation. And you can show the patient the information and verify its accuracy. Remember the goal here: accurate, clear communication. Deaf people don't encounter those in the hearing world that sign often. The moment you introduce yourself and sign, "Hi, my name," you're going to see a sigh of relief in their face. You're staying open-minded and trying to communicate in a way that is most comfortable for them.
This time, the ALS ambulance has arrived.
So I'll give a quick report to the ALS ambulance. So this is my patient. She's a 24-year-old female. Chief complaint was difficulty breathing. She has a past history of asthma. She has an albuterol inhaler for the asthma, or prescription for the asthma. Allergies are penicillin. Last oral intake was breakfast this morning, and she was just sitting on the couch watching TV when this attack happened.
Is there anything else you'd like to do for this patient?
Nope, that is it.
Okay, thank you.